The shadow came on us, took over our lives. But somehow now's the time we must unite.
Be bold, be brave, be still. In the end we shall heal. Cause there's an answer, and together we will stand and fight. Lagi lojing dum ka klam kitap ka ni. Ya kasha rak jinker men yin kde man kasi.
Nhìn nhắc lết kỳ chính ya lệ và kỳ chính he. Hà chính du ai nhìn sa bôi sha ka thong ka ba nghi bê.
We will gather at the darkest hour. Win this battle with faith and power. Long as we don't lose track of sight. Together we shall see the light. No one can stop us, let's stay strong. The road to a better tomorrow won't be long. Katung ay buong ching chidal gen sal sawan ching am tel gen takrukam. Kuay mo tingi perse खुशियाँ ना होगी कोई पाबंदी मिलके रहना है हमको जैसे हो कोई family.
Okay, be bold and be brave and be strong and fight on, live on. It's not the end, it's a bend in the road. Let's move ahead, no stopping yet. Let's move ahead, let's not forget. Faith alone draws every tear, and when all hope seems lost, let's bow down in prayer. No matter who you believe in, there's no denying a blessing. Heal and recover, let's stand here united as one.
We will gather at the darkest hour. Win this battle with faith and power. Long as we don't lose track of sight. Together we shall see the light. No one can stop us, let's stay strong. The road to a better tomorrow won't be long.
Issued in public interest by National Health Mission Government of Meghalaya.
Ladies and gentlemen, we'd like to welcome each one of you to this public conversation themed Paving Way to Recovery. This is the panel discussion brought to you by the National Health Mission, Government of Meghalaya, to consolidate public opinions around the areas of social recovery from the second wave of COVID and the need to always prepare for any wave that may come our way. My name is Kit Shangpliang. I'm the host for this panel discussion, and I assure you, this evening is going to be very, very interesting. Moving on, it looks like COVID has disappeared into thin air. Or has it really? Recovery is on, we know that. Whether it is the reopening of schools, colleges, places of worship, or the full restart of markets, sports centers, and other public places. But there is more than meets the eye, because the past year has taught us that we cannot take things for granted. Therefore, preparedness is key. So let's hear of what our specialized group of panelists have to say. And we also have an announcement later on what happened last week, the quiz whiz. We've got 3 lucky winners, and we've received lots of entries during the audience round. And stay tuned till the end of the program, because we will announce the names of those 3 lucky winners. Now let's get straight into introducing our panelists this evening. We've got with us Dr. Michael Maulong. He's the clinical microbiologist with Nazareth Hospital. As it is, we all know clinical biology plays a key role in combating any pandemic. We also have with us Reverend Bijis Imle, a religious leader who brings faith and reason together, a voice to reckon with. And we also have with us Dr. Rabbor Lalu. He is the maternal and child health officer from West Khasi Hills district, a man with passion for rural health care. And last but not least, we've got Mrs. Jenny Sindran, education administrator with the Department of Education. So she's going to join us after some time. But yes, I welcome the 3 gentlemen with us, Dr. Mike, Pastor Imle, and Dr. Lalu. You know, we are so happy that you spared your time to be with us, and we look forward to hearing from you on what you think about the present situation. So, cut to the chase. I'll start right off with Dr. Mike. Dr. Mike, you've been so close to the situation vis-a-vis COVID. And we know that Meghalaya is recovering from the second wave. It looks like COVID is over. I mean, if you walk the streets of, Shillong or Tura or Nongstoin or Joai, you see that people have started to take things for granted, all of us. So should we be worried? Or should we think we are safe? Are we really safe? Just throw us some light and perhaps set the agenda for us to take this discussion forward.
Well, thanks for having me on the show, Kit. The first thing is there's nothing to be scared about. Okay, we must continue with our lives. Is there going to be a third wave? If you look at the history of the disease in other parts of the world, if you see other pandemics that we've had before, in all probability there will be a third wave. Okay, but the important point is that a number of people have been vaccinated, and I'm hoping and praying that more people will agree to get themselves vaccinated. And a lot of people have been infected too. So what all of us are hoping is that if and when a third wave does come, if at all, if it does, it'll be a blunted one. Okay, it's not going to be as sharp and as bad as it was in the second wave. That's one. Now, the second thing is that we have to take care of ourselves. It's not the end, I can assure you that much. Okay, this virus is here to stay for quite some time. Maybe as a common cold flu, once we've all got ourselves vaccinated, but it's going to be here. Okay, so we must take our precautions. As we need to continue masking. We need to try and distance where it's possible. As you're saying out here, it looks like COVID isn't there anymore in Shillong. Okay, now we shouldn't take it so lightly. Distancing is important. And then again, as we kept saying, hand hygiene as well as personal hygiene itself. So in my humble opinion, it's not over, not by a long shot. Probably if it does happen again, a third wave, it'll probably be blunted. Let's hope so. And no, don't lower our guard. We have to continue doing what we are doing out here.
Thanks for that clarity, Dr. Mike. Now, moving on, since we are talking about reopening of institutions and reopening of worship places, I'd like to bring at this point Reverend BJ Imle. Pastor, they say protocols in worship places are followed. So let me ask you and break this question into two. So are they actually followed somewhere in some worship places, or are they followed everywhere? We know that this is the festival season. There will be events. So there are some of us who are concerned about, what will be in the next 2-3 or weeks or 2-3 months. And the second part of the question really is, therefore, what do you think the role of the religious leader in COVID times and post-COVID? Because we have to think about the role of the religious leader also vis-a-vis protection. So please throw us some light, Pastor.
Yes, thank you, Bakit, for having me on the show once again. Since I'm a churchman, and since we are in a state with a predominantly Christian population, where worship on every Sunday involves the assembly of a big number of people and at one time. Let me begin with a few comments on the observance of the protocols in the churches. In the churches, as far as I've seen, we are yet to observe the protocols uniformly. Churches in the urban areas strictly observe the protocols, right from the entrance of the gate, entry into the church building, seating arrangement, the wearing of masks throughout the worship, timing of worship, and how worshippers are led out of the church building to maintain social distancing. However, in the outskirts and in the rural areas, you will find churches who are very, very lenient. In fact, in some, there is no observance of protocol at all. Some in the outskirts and in the rural areas, they are somewhere in between. I would say that they are neither hot nor cold, neither strict nor lenient. They are selective in choosing which of the protocols to follow. If you ask me why it is so, I would say that it is all about how leaders in the local churches understand the issue and then manages and makes the necessary arrangement. My only suggestion is that the leaders should be wise so as not to force, but to also convince and make people understand about the benefits of observing the protocols. And I strongly believe that if people understand, they will definitely follow the protocols and the instructions. Many a times I've seen protocols being strictly followed inside the churches and inside the compound of the churches. But once outside, we see that all is lost. They forget all the protocols. So what I mean to say is that if the benefits of observing the protocols is understood, people are made to understand what people do inside the church. They will also practice that outside the church. And I think that is where the role of the church leaders. You teach them inside and teach them also how to do outside. Because I think that is a problem there. And I think this is the same problem not only within the churches, but in the other places of worship. Be it a mosque, which is to some extent similar to Christian worship, assembly of people. Be it a temple. Some temples, we see people lining up at the temple, especially on Saturday and on auspicious occasion. So the leadership should be wise in making people to observe the protocol, both in and outside the places of worship. And I think we, religious leaders, we have a big role to play in that. And I will also add that religious leaders should walk the extra mile. It is not only in the church and just outside the church,
Yes,
but even other times. Now
yes.
we are in the period where we are going into the festive season of Puja, Deepavali, and then Christmas. And most of the activities will not be inside the church, it will be outside the church. There will be shopping, okay? There will be feasting. I think that is where we have a role to play to guide the people. To guide them, but these are the benefits, or this is our duty and our role to play as followers of any faith. And I think religious leaders, we have a big role to play to guide our members, be it our church members, be it the members of any religious faith. Thank you.
Pastor, I'd also like to, bring into your attention. You very rightly said, once we come out from the four walls of the church building, and then there are also these cottage meetings, and when once you get into people's home and homes of the faithfuls, then you tend to offer them a cup of tea. So we've had instances where COVID spread at the time when people, and the hospitality, because we are a naturally very hospitable community. So I think, do you have anything to say on that? Maybe your local church, if there are some, internal protocols and understanding to in the interest of protection.
I think that is where we are always saying a new normal to be followed, even in the churches and by the churches and by the members of the churches. I think we have to let go to forget some of those things for some time. I think to find some other alternatives to meet those needs that we have.
Thank you very much, Pastor. And you've largely addressed not only the leaders of one faith community, but you've addressed the leaders and appeal to the leaders of different faiths, really. So I'd like to now bring another doctor, Dr. Lalu, and which we hope after which Mrs. Sindrem joins in. Doctor, you come from West Khasi Hills, so you've got a very strong rural background and rural perspective vis-a-vis your profession. So as the state reopens and as West Khasias district, reopens, so what are the issues impacting the rural population? Because we've also heard that the issue of maternal health has taken a beating because of COVID, and that goes alongside, different understanding of vaccine and vaccination. So please, doctor, tell us more about the ground realities from West Kasia.
Yes, Vakid. Since we had the pandemic last year, the maternal health has really been affected by this pandemic. Firstly, because of the effects of the virus as it is on mothers, and secondly, because of the fear of the virus. So, pregnant women are always considered a special population because they are at a higher risk. They are more susceptible to a disease, or they develop more severe forms of the disease when they do contract it. So this is in part because of the unique immunological condition that is caused by pregnancy. So that is the effect of the virus as it is on pregnant women, pregnant mothers. Secondly, we have the effect of this pandemic on maternal health services. What we have seen in West Khasi Hills is because of the fear of this disease, because of the fear of testing, a lot of our pregnant mothers are not coming forward for ANC checkups, for their normal checkups. They're not coming forward to the hospitals for deliveries. So this in turn has led to a pretty sharp increase in the number of maternal deaths, maternal mortality we have seen during the last year. Just some statistics. Last year, before the pandemic hit the world, hit West Khasi Hills, we had about 20 maternal deaths in West Khasi Hills in an entire year. This year, 2021 going into 22, in the 7 months, already 18 pregnant mothers have lost their lives, and most of it is because they are their deliveries are being conducted at home. So yes, this disease has really had a very severe impact in maternal health and maternal health services.
Doctor, I'd like to seek one clarification from you. When you said 20 plus deaths last year and this year, uh, can we connect that to vaccination hesitancy, or is it because of some other reasons? And I would like Dr. Mike also to, listen to this conversation at this point, and then perhaps slide in. But over to you, Dr. Lalu, first, if you can address my question.
So the reason why certain mothers do not come to the hospitals for their deliveries, not only some, actually a sizable number do not come to the hospital for deliveries, is because number one, they don't want to enter hospitals because there's that fear that in a hospital the virus is circulating, and number two, it was previously it was there where it was mandatory for all people coming to the hospital to be tested. But now, since we've encountered these kinds of problems, we don't. It's not mandatory anymore for people assessing services in hospitals to be tested. So this is basically the two reasons why we had a huge shortfall in people assessing services in hospitals, especially in public-run institutions.
Dr. Mike?
Yeah, uh, just as Dr. Rabor has just said, we must understand one thing. Okay, our country was a bit late with bringing in the advisories and vaccination in pregnant women. Okay, but the two go together in this pandemic. If you're pregnant, get vaccinated. It'll help you and it'll help your baby. We have lost babies in this pandemic because of this. The mothers who didn't take the vaccine when it was available to them. Now that's very sad. If there's a way we can prevent a death both of the mother and especially of the child, I mean, we should take it. It's an opportunity that is available to us. The scientists have worked hard. They've given it to us. God has given it to us. Take it with both hands. Okay. And since we're talking about mothers also, I'd just like to mention briefly upon people who are immunosuppressed, like HIV patients. Okay. The vaccine is not a HIV is not a contraindication to get the vaccine. You can get it. The issue is because of the condition you are in, particularly if you're not taking your medication, antiretroviral therapy, what happens is that your body cannot produce enough antibodies, okay, to mount an immune response. So what happens that maybe the response to the vaccine is blunted slightly, but it is not a contraindication. Please remember, HIV in itself is not a contraindication to that. That's all I want to say. Thank you.
Thank you very much, Dr. Mike and Dr. Rabor. Te kendia tak kin kasi kini armut ki doktor ki ong ba ha kapor ke ba ke kene ke armet kadon ke jingma lada kim a ya ketika te ke jing kerpat dongki bat ke jing pun soto ke ba syai kedar mentan ki ong ba let ban a ya ketika lada hidei ki ba ki ba kit ya ikunlung dongki ha kapo dongki let ban le kata ban yada ningkong ya phi but ya ikhulung ban hapo jong phi that was a very clear unanimous sort of from the two doctors advice and I'd like to bring forward now Mrs. Jenny Sindrem. Ms. Sindrem is Mrs. Sindrem is with the education department and the question to you, ma'am, is the world, we've been talking about reopening of schools and colleges, of worship places and marketplaces. So we know that the world can't stop forever because of COVID. Life has to go on, and so does education. So please tell us something. How prepared are we to reopen our schools? When vaccine is not available to the children.
Okay, thank you, Mr. Vakit, for that particular question. First of all, the things that the education department has issued a letter, a notification on 26th of August that school should reopen. It is not just by saying, but we have had a thorough discussion, a very deliberate discussion with the ministers, with the chief ministers, with the minister of education, and with all our ACS, then with the health department and all we have been sit. And there was a findings also by the fourth national survey of the Indian medical research, which have reported that 67.6% of the Indian population has antibodies against the virus, and that the children had a similar role of infection, thus protected by now as adults. This has been corroborated by many other state-specific and local surveys. So we have just not opened school or reopening of school just like that, but we have based on the surveys. As we have mentioned that 67.6% of the Indian population has antibodies, so which is resistant to this particular virus. But to protect against that, we have issued another notification in September that schools should be open like from in the rural areas, from elementary level to secondary to senior secondary level, the school should be reopened. But in urban areas, from classes 1 to class 5, school can have a school visit, just maybe alternate days. That also depends on the consent of the parents. And then for the class 6 onwards till class 12, we have issued an order that they can open schools, but we have minimized the number of students. Instead of going around, let's say an enrollment of 40 students in a class, but we have to divide into two sections, maybe 20 students in each section. That means they divide the time. The allotted time is that 2 to 3 hours, means minimize the time of the children to stay in school, and also minimize the different time. Then as teachers, they should encourage the students to have a proper maintain protocols. Like if you enter the school entrance, you should stand in a queue and maintain a distance of 6 feet. as being provided by the protocol. So this clear instruction has been issued to the school. Around 30 variables are there which the schools need to be followed, and a proper sanitization of those areas which is being commonly used, especially the toilet areas, the washing station. So these are the things that we have been prepared for the school. And if cases come, if a student is sick, or maybe a family member is sick, it is a strict school authority has been designated that they should ask the student to stay at home. It is the duty of the parents now how to deal, like if they have these type of symptoms, like a little bit of cough or fever, that they should maintain that all the children should remain in school so that the other children cannot be infected. So in this manner, we have issued the instruction. And also, further, there is a consent, also a task force under the leadership of the deputy commissioners of each district. They could create a task force which is headed by the deputy commissioner, and then with the district school education officers, they are there to, and some community members, school management committees, along with the parents and teachers. So in this task force, they have mentioned what are the areas to be looked after, so that strict protocols are being maintained in the schools, so that these cases of viruses will not be brought. So these are the preparedness that we've been issued.
Yeah.
Then children, they are in when they are in school, they should not share tiffin, so that it is the school, it is the parents that they have to see the neat and tidy of the cleanliness of the school bag. Then the children should not share their eraser, their pencil. So it has been notified very well in the notification, the government notification itself. So then we have then instructed the school also, the school authorities, that to not allow children to have a group, like to have cultural programs or to hold sports activities, because sports activities also we need contact. So we don't know that these what in which houses there is any positive cases. So to avoid the diseases, so these particular instruction that no cultural activities can be promoted in schools, no sports activity can promote in schools, just learning, so that we can bridge the learning gaps of the children. Also further, we have also asked the school instruction to make the children to wash their hands regularly, sanitize their hands regularly, and maintain a distance even in the classroom about 6 feet, as per issue by the government. So these
Yes,
are
I
the
think
few tips,
yes.
the few particular SOP that we have been introduced in the school. So this will
Yes.
help us in reducing. These are the few things that we have been
Yes. Yes.
preparing for the department.
Very valuable information, Sindrem. And I'd also like to, invite our doctor friends, because, parents now have this question whether is it safe to send my child to school. I have friends and, who are mothers and fathers. They're very, there's no clarity as such. Because especially in the urban area where parents and students still enjoy the opportunity of learning through virtual learning, so that is also another option. But here we have to go back to school, but how practical from medical science perspective? Either one would
Will,
be.
will I take that?
Yes, yes, please, Dr. Mike.
Rabor, would you follow after me?
Yeah. Dr. Mike, you please go
Okay.
ahead.
Okay, let's put things in perspective. No, our life must go on. We can't go on this way. Okay. Now, I don't know how many of you have heard of it's a kind of an organization called the Indian Academy of Pediatricians. Okay, or Indian Academy of Pediatrics, IAP. It's arguably the most scientific driven uh, group in the country. They issue guidelines for pediatric patients in our country. So they came up with a positional statement last month. What they have said is very, very clear. If you look at the risk of COVID in children, and if you compare it to what is going on with children right now, sitting at home, growing fat, no playing, zero communication skills, they are not studying, looking at their phones, looking at social media, the risk uh, of COVID is extremely minimal. as compared to what they're going through, the suffering that they're going through without knowing it, without understanding it. Probably a lot of parents also may not be aware of this. Okay, so does COVID happen in children? Yes, it does. Of course, it does. Now, is it severe? No, it isn't. Most children will not develop pneumonia also, COVID-related pneumonia. Okay, so we must understand that most children who are infected are either asymptomatic or very mild, just like any other cold. Okay, a very small percentage will be admitted to hospitals. And from those who are admitted, a very small percentage will actually be severe. And almost all of them will have some kind of a comorbidity, born with a problem with their heart, with their lungs, or something like that. So we must put things in perspective. If you ask me as a parent, we've decided, my wife and myself, that when the time comes for our older child, yes, we will. For the smaller child, we'll wait and see as things evolve. And if you look at the population of these children, okay, they constitute about 44% of our country's population. Of 1.35 billion people, they constitute 44%. And from those 44%, 12% have actually come in contact with the virus, either asymptomatic, mild, whatever. The vast majority, vast majority by far being asymptomatic or mild. Okay, nothing's happened to them. So you must weigh it now, cost benefit analysis, and look at it. And if you ask me, in my personal opinion, I think it's time to go to school. Okay, take precautions. By all means, take precautions. You have to mask up, distance, things like that. Okay. Now the second point I'd like to clarify, not clarify, actually, to bring to the notice of everyone out here is that the vaccine is around the corner. Okay, so we have two companies right now, Zydus Cadila and but the Covaxin. So they will probably be rolled out for the 12 to 18, hopefully by this month. Okay, we're still not sure. Now the government of India is still working out logistics, so it may take some time. But when that happens, that's going to be a very good thing. So I urge all of your parents who are listening to this program, please get your children vaccinated when the time comes. That's all. Please, Rapport, could you add?
Dr. Michael, what you said is very true. I mean, the vaccine for the 12 to 18 will be out very soon. And then this is also a message to the parents, since the kids are not eligible for vaccination right now, if we want to protect them from this disease, then it is our duty as parents to make sure that we take this vaccine and prevent this virus from being transmitted to our young ones. I mean, that's one aspect of this pandemic which a lot of people seem to be blind to. That it is our duty to protect our children by getting ourselves vaccinated. Thank you.
Thank you both to both the doctors. I think you've spoken with one voice. Time to go to school. Life has to go on. Precautions to be taken, and vaccine is just around the corner. So hope is around, and I'd like to just sum it up in Khasi also. Kaya begitu ki doktor ki ong mentan kalong ba hakaway bayadey ba kajing play ki school. Ki ong bakala sngan mentaban play ki school. Henry ngidang day pa de ban yada yaladi namar kat day tang kata kaba pla yangi bangin yakun yaw ni knyang jingpang ke covid khat khandai te bat ki ong ru ba kadon ke kubor ke bha bat ke ba wan ra shibon e jing kermen namar ba uni kani ketika nakabenta ki khna ru kan sawan shen kala ban chimpor katu kani bana Henry kan sawan shen bat baro na pring jungi in yo ya kajingnya dago pura khamtam ki khna te I'll like to thank all the panelists for now. We would like to slip into a quick break, but yes, if you have questions or you need support, help of any kind, or even if you have a question to the doctors and the panelists here, you can call a toll-free number 14410. It's right there up on your screen. The toll-free number 14410. You can also download the Behavior Change app. You will get all the information around COVID-19 in Meghalaya, and the app is also there, flash on the screen. And of course, make sure you get your second dose. For those people who've got their first dose, make sure you get your Second dose, if you're not vaccinated once or twice, if you have been vaccinated once or twice, show solidarity by making this frame that you're seeing now on your profile, as your profile frame on social media. Okay. National Health Champion, follow the instructions on the screen. It's very, very user friendly. Yes, and we have the winners, three lucky winners from last week's quiz whiz. During the audience round, we received a lot of entries. And yes, stay tuned because we will be announcing the names of these three lucky winners towards the end of this discussion. So it is time now that we slip into a quick break. We'll see you on the other side.
Nah, kamay mtasi. Kam biang pi. Belayu. Pi so diaw ba. Kadao ko lang ba ngampat sim ketika ya dah COVID-19 teh. Kadao ki brio ki semua atapien teh ban ki ka taksi jonga. De boleh pa pemle sim eta encek eta. Kata ken kwa tambah ngasnguk lumar jemut. Banle et ko online ter bas kuwi kolong bangamdan teh ko phone ko babiang bandan ning internet. Hentip sa baga sarkar kalau sedang banai tika kelam dan kaman bukupa. Pisulai bed pedang tuang tu penyoy ka. Syasa. Ha. Pisulai bed akan kuno ke caka ain jack akan kuno si baki ai. Dengkat baka ID jong pi ba penyoy ketika dana kelam COVID-19. Hemdan kam banne lupa akan kuno ke registration. Inspelnya hiya tu ke caka tika. Kata ti kubuar babai kanya nga. Itu kata saya kendo mau. Abab beli kerja ya. Nak kerja balik simno ketika ya dah mentah kesini. Mapipat. What I doubt you. Simi ketika ya dah klaim dapat sab issue ekapor.
National Health Mission, Government of Meghalaya.
After that break, welcome back everybody to this panel discussion, Paving Way to Recovery. And for those who have just joined us, we've had a very interesting conversation on how we adapt to changes on our road to a recovery and not to take things for granted because COVID is still around the corner and vigilance is key. Of course, vaccine is available and vaccine for children is also around the corner. So now let's probe further into what our panelists have to say. I'll start this next question, and I would like to bring Reverend BJ Simle. Pastor Simle, we'd like to look at some solutions and hope in this second round of this conversation. As a state, we are at 53% vaccination, and 47% is we are yet to achieve that, and it is an uphill task. We are cutting a sorry figure for the state. If you think about it, comparing it with the rest of India, in Meghalaya, there is also evidence to prove that faith is one of the reasons for this uphill task, to be very frank and honest. And it is not just a rural issue. It is also an urban issue. So the question, therefore, is there a tug of war between faith and reason? Or is there a possibility where the two can meet? Pastor, will just please throw us some light around this.
Bucket, yes. If we look at the outward signs, I agree with you that there are evidence to prove that faith is one of the reasons for vaccine hesitancy, which resulted in the low vaccination rate in our state. But again, we have to put things in proper perspective. Is it faith or the misuse of faith? That is the question I've always been asking myself. This statement has direct reference mainly to Christians, being a Christian-dominated state. And we are all aware that in the midst of all the struggles that we went through, some what we call freelance preachers, or we call them, some call them the preachers of the prosperity gospel. They go around teaching people, linking the vaccine with the number of the beast, or saying that the vaccine is a sign that you lack faith in the miraculous works of God. But I think the other part, the miraculous work of God, is something that is to be debated somewhere else. So I would ask that question, and I have always been asking myself, is not this a teaching which is a false belief, brainwashing people by some people for self-gratification, many monetary gains, maybe just to satisfy themselves with what they are doing? And most of the people, most of the victims of this group, they are simple folks. Many are in the villages, some are in the urbans. But let us also take note of what you have hinted in your question. To take note of, there is another group of people in our society, the educated, the urban based, who are hesitant to take the vaccine. Through my personal experience with some, I found that there are some of them who are basically scared of the needle. Yes, since childhood, scared of the needle. My father would faint when he sees the needle. And then there are some who are apprehensive about the efficacy of the vaccine. That is the fear inside of them. And to hide their fear, what they do is they justify those teachings from the Bible to fight what is inside of them. That's why I'm saying they misuse faith. They misuse the teaching of the Bible. And I would say that most of the people who fall in this group are the educated and the urban. And I tried talking with some of them. I just realized that for some of them, it is just a big mental block. They would not listen. So that's where I say to myself, we have to be patient when dealing with them. So we have these two groups. But whatever it may be, I think we have to appeal to one and all to accept the fact that faith and reason, or science and religion, they should go hand in hand. We are in Shillong. Dr. Maulong is there from Nazareth Hospital. We have Gordon Roberts Hospital. We have the upcoming Ramakrishna Dispensary. All faith-based institutions promoting medical science, using medical science even to propagate that faith. I think that is where faith, medical science, we have always been saying that we go hand in hand. But in the midst of that, there are some who twist the whole issue. And being a theological educator myself, we always teach and say that one of the formative factors of faith is reason or scientific thinking. There is no faith without proper reasoning. Otherwise, it becomes what? Blind faith. That is in Christianity. But even if you go to Hinduism, Hinduism also goes side by side with what? Hindu philosophy, Hindu religion, Hindu philosophy. So they're always side by side. That's why we keep on saying that faith needs to be complemented with a scientific temper. I think that is the issue that we have gone through as a country. Then we have to remember that the basic purpose, the basic aim of science and religion also are very, very close. Science would explain the empirical world, the world that we live in. And faith would act as a guide how to live a meaningful life. I think we have to be very clear on that. Science helps us to explain how the world is made, what is what, all the disease, the sickness, the problem. But faith would guide us. I'll just take one example. We do have abortion and all those issues in medical science. And that is where faith comes in to help us decide whether this is right or wrong. At what point of time it is right, at what point of time it is wrong. I think that is where faith and science, especially medical science, go hand in hand. And always, I go by what Albert Einstein says. He's a scientist, but he would connect science and religion. He says that science without religion is lame, and religion without science is blind. Science without religion is lame because science will not know where to go, which direction to go, without the guidance from religion. And religion also without science is blind, as it will not be able to see what is going on around it. It will not see what lies ahead. So that's where we say that we need to know where to go. We need to see what lies ahead of us. Faith and reason, science and religion are compatible with one another.
Yes, Pastor. Well, thank you very much. Those are wise words indeed. And Dr. Mike, you want to say something now, or shall we move on? Because he said faith and scientific temper. I really like that correlation and the connection between the two. If you don't have anything to say, Dr. Mike, we'll go ahead.
I completely agree. We need both of them to guide each other. Absolutely.
Thank you. So yes, but as we speak, we talk about the 47% uphill task. Dr. Mike and Dr. Lalu, the vaccination drive is on, but vaccination hesitancy is still the issue in our state. I've had a chance to travel to Jongsha. I've had a chance to travel to Southwest Khasi Hills, and all these places. And I know once a person decides that, okay, I'm not going to do it, then you just get to understand that he will not do it. So, Dr. Mike, let's assume if I come to you and tell you that vaccination is a farce, and I have made up my mind, you're my friend. You have made up my mind that I will not be vaccinated. And how would you convince me otherwise? And what is the likelihood that, this virus would mutate into any more variants in the coming months? So let's take the first one where I come to you and I'm very decisive. Say, whatever you want to do with me, you put me in prison or you do whatever you want, but I'm not going to, accept it. How would you otherwise convince me? Because we live in that situation today.
That's difficult, very difficult. Once you've decided to say that no matter what happens or come what may, I'm not taking the vaccine, then explanation becomes very difficult. But if you're willing to actually entertain, an explanation, what is your fear? What exactly is it? As Pastor has just said, is it the needle? Or is it some other reason where, it's just a mental block with the words that he used? Or is there any other reason? Now, we must understand, put things in perspective. The vaccine protects. There's no question about that. Absolutely no question. It's been proven time and again. Okay. In fact, a lot of our patients survived because some of them had at least got that single dose. That made all the difference. Okay. That's one aspect. Now, it actually prevents severe disease and death. And ultimately, what is it that we want to do? We want to live. We want to live our lives with our families, our friends, get on with it. So the vaccine does make a difference out there. Now, another point we must understand is that, say, for example, with the swine flu, okay, you have a vaccine for that also. Now, the efficacy of the vaccine, or to put it, how effective is it? It differs from year to year, but it has right now, the present vaccine for this year works at about a 50% efficacy. Okay. Now that's much less compared to the COVID vaccines that we have. Even the worst ones are still better than the flu vaccine. Okay. Now, the second point about it is that flu has a reservoir in animals. In the case of swine flu, it's pigs. In case of bird flu, it's different birds. So trying to eliminate the disease is very difficult. Why? Because you can't vaccinate those animals. You can't do it. It's
Mhm.
not possible. Now, in the case of COVID-19 SARS-CoV-2, to date, it's been almost 2 years, we have not been able to find a reservoir for this disease in animals or birds for that matter.
Mm.
So, therefore, the corollary is that it is only happening in human beings as of now. So, if we want to stop it, we vaccinate. Please accept the vaccine. Please understand that it is the only way that we are going to stop this pandemic and perhaps reduce it to the status of a common cold. Okay,
Mhm. Mhm.
it's vitally important that we understand this. So once again, I appeal to all of you, those who have any hesitancy, if you have any scientific reason behind it, or a mental block or some other thing, we can get over it, but at least give us a chance to explain to you. As scientific people, we will try our best to do what we can. And as Ravan has just said, that yes, the people from uh, the faith-based organizations also, they can also help with this. Thanks. Thank you.
Thank you very much, Doctor. That clarity, if I understand you right, which means the fact that this rests only with the human beings as of now. So if there is participation, which means there is a higher chance of arresting COVID-19, in our generation. Am I right?
That's right. That's right. And another point, which I think Dr. Abor had also brought up earlier, it reduces transmission. It doesn't stop it, but it reduces transmission. So it's both ways it works.
Yes. Um, I would like to bring Mrs. Sindrem again, slightly deflecting from whatever we've talked about, yet related to the theme. Um, Mrs. Sindrem, amidst the challenge is that, how do you facilitate learning, during COVID times? Because learning can't stop. That's what we talked about. And of course, learning also, if you look at rural, urban, and then you have the people in urban who can afford and those who cannot afford. And then you're talking about, Android phones and availability of internet. So how do you overcome those challenges? Perhaps, the Department of Education has had some opportunity to, explore innovations and all of that. Can you share with us?
Okay, thank you, Mr. Kid, for your question. Okay, first of all, it is we have done a survey during the particular when it started the COVID last year. So here we can find that how people divided, right? If we can look around at the urban center, urban areas, we would have around 58% of the students who have access to digital device. So we cannot leave these 42% which is not having access to the digital device in the urban sector. And when we look at the rural sector, we would have about only 19% could have a digital device, access to Android phone or be it television or be it computers, etc. So we also have 81% of the students in the rural areas who do not have access to any digital device. So although with this pandemic, we have to see the learning losses of the students from the education side. So looking at this matter, there are teachers in the rural areas, especially, who went to the us house visit to to the student's house. One student or two students they went for house visit, maintaining the protocol being like social distance, hand washing, wearing of double masks. This has been conducted in various parts of the rural region. And even notes and worksheets were being provided to the students by the teacher calling the parents to the school. Even at the urban central or urban area also, even at the rural areas also. These are a little bit, and for those who can access a digital device, through Dudarshan Kendra, we have been launched some program class-wise. And then through GeoTV also, we have been arranging for classes. And these are being provided through WhatsApp messages by the teachers. I could have, I think all of us, we have kids, we have children in our own houses. We see notes, videos is being coming out for those who can access the digital device. But for those who cannot, then teachers are working very hard. At least we have to see the future of these children also, because especially for the classes 9, who has supposed to go to class 10 and again to do their examination. So these are all the procedures being provided by the teachers. Although with this pandemic, but we have to really take around that all the students should get access to learning and at least learning losses. What the education department has also issued some order, the notification itself speaks that we will have in the winter vacation also we will have classes, and then we will have examination like this year in 2021 we have for the last year's exam 2020 we hold in March 2021. So this
Yes.
procedure, at least long academic session, will be extended for the
Yes.
students, at least to cover that particular areas where
Yes.
the learning losses of the students.
Mrs. Sindram, we have a person called Banker Nonkindri. He has a question, and I think this question is uh, addressed to you. He says, how can a parent deal with a child who is scared to go back to school? All of us are parents, so we can, any one of us can also chip in, but specifically to you, Mrs. Sindram, if you can just respond to this question asked by Banker Nonkindri.
Okay, so Babankar, if you are in this particular session, me as a parent, suppose there are many cases, might be a child who is very frightened. It depends upon you, a parent. It depends upon the surrounding. If you, as a father, if you're has a, suppose now if there's some you have been in contact with as a primary contact with a COVID positive person, suppose, and you went home with panic reaction towards your wife, towards your kids, towards your children, definitely the mentality of the child will be towards that, making it very scared. I'm scared to go to school because why? My father told me, my mother told me that if you go to school, you'll get COVID. No, this is not the case. It would be, I have been experienced just with myself. Okay, first of all, I've been contacted with one positive person because we go to work even during the pandemic or so because of our office work. So when we have contacted with this person, I just call my husband. Look, I'm contacted with a positive person. Please keep away all my children. Okay, please keep away my children. Don't allow them to meet me. Please arrange me the room where I can go directly to the bathroom and do my bathing, etc. And arrange me one room that I can stay, or else I might stay somewhere else where there is a COVID center. We do have the headlines which the health department are giving us. So we could call those numbers. And then that's why we are asking in the notification that the numbers, the toll-free numbers of those particular areas need to be provided, stick in the school, in the premises, so that teachers, parents, students can see these. So in this manner, we can treat our child and make them not scared of the COVID, because children are
Yes.
their mind is very sensitive. It is
Yes.
all because of the adult. It is because
Yes.
of me as a parent. So this is what my answer to you. I hope
Very
this
valid.
will meet your views.
Yes, thank you, Mrs. Sindram and Banker. I hope you're happy with that response. Any one of you would like to jump in and add to that? Okay.
No, she's
Now
covered it
I'll
very well. She's covered
cover
it
it
very
very
well.
well. Thank you very much, Mrs. Sindram. Now we have the last question and I'd like to bring Dr. Lalu here. Again, the rural perspective. Dr. Lalu, people are saying there's rural and urban divide, vis-a-vis COVID. It is true, and in a way, and it is also not true, because when it comes to a positive response to vaccination, And if you compare like villages, even in West Khasi Hills, you have Nong Pendeng. I was having a chat with the Rangbash Nong there, and he said it is 90 plus% vaccination, which is much better than some of our urban localities. So I'd like to all of us to look at hope and see, if Nong Pendeng can do it, and tell us more about the hope in West Khasi Hills. I know you've got challenges, but just please share with us the stories of hope from that district.
Yes, Bakit, I am so happy you took the example of Nong Pendeng, because Nong Pendeng is a very good example of how, when civil society and governmental agencies work hand in hand, we can achieve anything. So in Nong Pendeng, the Sardar of Nong Pendeng, the Mintri of Iman Nongstoin, who is a resident of Nong Pendeng, they went for house to house campaigns to try and get people to come forward for vaccination. They worked in close coordination with our ANM, Gentleness Karmonglam, with our Asha Monica Thomni, and it's because of that good cooperation between the Shnong and these people from health department, including the Anganwadi workers. That is why we've been able to achieve 90% coverage. There are numerous other villages in West Khasi Hills who have been able to achieve 80, 85, 90% immunization coverage. And that is because of the cooperation and working together. Another reason, another hope for West Khasi Hills is that West Khasi Hills has a very young population. If we look at the vaccine coverage statistics, 55% of the above 45 have been vaccinated. However, only about 24% of the 18 to 44 have been vaccinated. Now, the 18 to 44 are the age group which are more technology savvy. They are people who will be accessing this kind of a discussion in a social media platform. So there is hope that we can get through to the younger age group, and they will come forward because they're an age group who are we can still mold them, we can still make them understand regarding the importance of all these healthcare initiatives. So yes, there is a lot of hope for West Khasi Hills, and in these coming months we will definitely improve our immunization coverage, our COVID-19 vaccination coverage.
Well said, Dr. Lalu. And you know what? We've come almost to the end. And dear viewers and panelists, it has been a very insightful conversation. We've talked about a lot of issues and about the people, the challenges, the responsibilities, and how do we pave way for recovery. Yet, prepare for what could happen. I will take this time to announce the names of the three lucky winners. And as I said, there was a quiz whiz last week, and there were, a lot of participation, received lots of entries, and you see the name of the question number one. It's very small here, so let me try to find out how do I increase that. Okay. We've got two questions during the audience round. And the first was, name the app developed by NHM Government of Meghalaya on COVID-19 pandemic. It's available in Khasi, Garo, and English, and it can be downloaded from Google Play Store and Apple App Store. The answer is Behavior Change Management App. And the second question was, when did Meghalaya record zero new COVID deaths for the first time since the second wave of the pandemic? And the answer is 6th of September 2021. And the three lucky winners are, there we are, Quiz Whiz audience special prize winners. First prize goes to Rapstar Kharkongor, second goes to Akshat Podar, and third goes to Juhi Wanki Pala. So we'd like to congratulate all the three winners, and we hope that you continue to participate, and we wish you all the best in your life. Okay. Yes, we've almost come to the end, like I said, on this panel discussion. There will be some last words from the panelists, though, and I'm going to give each one of you 1 minute, each starting with Mrs. Sinrem, and after which Dr. Lalu will take his 1 minute, Reverend BJ Emle will take his 1 minute, and Dr. Michael Maulong 1 minute. So over to you, Mrs. Sindrem. Your time starts now.
Okay, thank you, Mr. Kit. Actually, the concluding remarks for this today's program is that even in the notification, we have also inserted those vaccination status of the teachers. Around 60% of the teachers have received first dose vaccination, and around 23% have received the second dose. So, and in the government notification only, it has been mentioned that all teachers need to be vaccinated in order to protect their children from coming to school so that they will not act as a carrier. And then it has also been said that if you vaccinate yourself, you prevent not only yourself, but you also prevent the society, especially you're caring for the children who are your students. So it has also been mentioned in the notification, government notification, that if teachers or non-teaching staff are not ready or they are not willing to take the vaccination, they have to undergo their RT-PCR test every 10 days. So it is mandatory for all the teachers. It is the responsibility of a teacher that they should take the vaccination, because this will protect everyone. It will protect your own children, your own family, your own beloved one, and definitely it will protect your students and the community at large. So please do take the vaccination.
Very valid. Thank you, Mrs. Sindrem. Dr. Lalu, over to you.
Yes, when it comes to vaccine hesitancy, one of the main reasons is because of news which is circulating in social media, so on and so forth. So in this age and time when we have the internet, so the internet can be a source of a lot of good information, but it can also be a source of misinformation. So it depends upon the people. It depends upon you yourself to get the right information, make the correct decision, and come forward for vaccination. And let's not listen to all this fake news which is circulating here and there, saying this and that. So be wise, even nice. Thank you.
Thank you, Dr. Lalu. Short and sweet. Reverend BJ Simle, if you can come now.
Yes, Market. The coronavirus is very deceptive. I liken it to the game of snakes and ladder. When we look back at last year, we went through all that and then back to zero again. And from our experience, we saw that at its height, it caused fear and anxiety. And as it subsides, it made us all complacent. And complacency is the danger for both the vaccinated as well as the unvaccinated, as we are now in the process of reopening. So I would appeal to all that let us realize that COVID is here to stay. We don't know for how long. We have to make some adjustments with those new style of living. For the vaccinated, let us still follow the COVID appropriate behavior. And for the unvaccinated friends, our appeal is to join us as we have to fight the fight together. And for all of us, let us remember that we need to lead a healthy lifestyle, be it our food habits, our sleeping patterns, everything that we do. And let us teach our kids to avoid junk foods at this moment. For the grown-ups, I think we should avoid smoking tobacco. I think the doctors can tell us better. And this is the best time for us to curb all those which would not only affect COVID, but the other diseases.
Yeah, I'd like to believe that our two doctors don't smoke, and I believe so. But Pastor, I love your keywords. I love your analogies and your wisdom and your oratory skills. You put it right there. Perfected it in a nutshell. So, but for now, the last word goes to Dr. Mike. So, your last word, Dr. Mike.
I'll keep it short and sweet. First thing is the pandemic is not over, not by a long shot. Okay, so please keep your guard up. Keep your guard up. Use your masks. Socially distance. Second thing is vaccinate, vaccinate, vaccinate. If you don't want to protect yourself, remember when you vaccinate, you're going to protect your children and the people around you. It's very important. Please, I emphasize again on this. Please vaccinate. Third thing, life must go on. But when it does go on, we must behave responsibly and let life go on. Well, okay, that's all. Thank you so much for having me on this program.
Yes, thank you very much, Dr. Mike. And I'd once again like to thank all the audience out there. And again, the panelists, Mrs. Jenny Sinrem, Dr. Rabor Lalu, Reverend BJ Simle, and Dr. Michael Maulong. It's been a very, very purposeful conversation, and takeaway is that in the midst of all these, challenges, I think adaptability is key, preparedness is key, and therefore we have hope in humanity. So thank you once again for your time. And this panel discussion is brought to you by the National Health Mission, Government of Meghalaya. Until we meet again, goodbye and good night.
Kublai, atu pitep bayu knyang jupang COVID khat khandai, la ban pindu jan, da manga bat mapi, hoi, ringkat lang, nila, alai bat nga, nan puni kumno. Hagano ko por ba pijur ho ni senria, kunma berbor ba pidai bandai la ka cintur da ka jan rumal. Kat bala yele ban perking yel dia ban kta ila ki kman ka kmut bat ila ka cintur. Sak bahaya lagi jongki kiti daga sabon kumba arpau second AA. Penjengai iwe ni iwe, bat dakin mau, ban yeng jengai kumba nruput AA. Kebakong san AA kadai ban dengi ki mas man la kapor, kawi ka surgical mask, bat kawi ka mas jan nalor. Lada pidan kano ga jimpang kum ka jerho kishit penhiar thaj man kapor, shitom ban ring man siam, do akabor jengman, bat akabor jengsma. Phone Shaki Health Center kibadan Hajan Jongpi lani pila ban call yau ni toll free number iwe sao iwe not nampai kino kijing yarau ini bangin yarau ipi.
National Health Mission, Government of Meghalaya.
Hey Kongdeng, where to? Seems like somewhere special.
Yes, it's special. I am very proud to be a part of India's largest vaccination drive.
Are you not worried?
Why will I be? Instead, I should be worried if I'm not vaccinated.
But people are saying so many things.
People will always have something to say.
Will it really protect me from COVID?
Vaccination doesn't mean you are 100% COVID proof, but your immune system will be strong enough to fight even if you contract COVID-19 and it is not life-threatening.
I heard it has severe side effects.
There may be mild side effects like fever or chills or maybe headache, but that's normal. It will wear off on its own.
But is it really safe?
Of course it is absolutely safe and backed up by medical professionals. Doctors, engineers, politicians and many more are chosen from all sections of the society to be vaccinated.
Yes, you are right. I will also get vaccinated immediately.
Don't waste your time anymore listening to fake news and gossip. Take a decision to get vaccinated with confidence.
National Health Mission, Government of Meghalaya.
The shadow came on us, took over our lives. But somehow now's the time we must unite.
Be bold, be brave, be still. In the end we shall heal. Cause there's an answer, and together we will stand and fight. Lagi lojing dom ka klam kitap kani. Ya kasharak jingker manin kreman kasni.
Yin ya klet ki jing ya le bat ki jing he. Ha jing du ang yin sa boy sha ka thong ka bangi be.
We will gather at the darkest hour. Win this battle with faith and power. Long as we don't lose track of sight, together we shall see the light. No one can stop us, let's stay strong. The road to a better tomorrow won't be long.
chidalgin salsawan chingam tilgin takrukam kuai
no tingi persecution ना होगी कोई पाबंदी मिलके रहना है हमको जैसे हो कोई family.
Okay, be bold and be brave and be strong and fight on, live on. It's not the end, it's a bend in the road. Let's move ahead, no stopping yet. Let's move ahead, let's not forget. Faith alone draws every tear, and when all hope seems lost, let's bow down in prayer. No matter who you believe in, there's no denying a blessing. Heal and recover, let's stand here united as one.
We will gather at the darkest hour, win this battle with faith and power. Long as we don't lose track of sight, together we shall see the light. No one can stop us, let's stay strong. The road to a better tomorrow won't be long.
Issued in public interest by National Health Mission Government of Meghalaya.